Work only if you are well. Food handlers must practice good hygienic work habits so they become second nature. It is important to work in a clean and tidy environment. Whenever sick, you should not work with food. Various personal health issues may cause hygiene risks if you are working with food. Therefore, you should report health problems to your manager before working with food. Health issues that may cause a hygiene risk relevant to food safety can be transmitted as airborne, foodborne, or infectious disease. An airborne disease may be passed through coughing or sneezing, such as the measles. A foodborne disease is passed via bacteria in the food, for example, Salmonella. An infectious disease can be spread through direct contact, such as through touching surfaces, utensils, or food, for example, the common cold. Stop. You should stop food handling activities where your own health issues may cause food contamination. The germs you bring to work can spread when you sneeze, cough, or when you touch food, dishes, utensils, counters, pots, pans, and other people. If you feel sick or have a cold, the flu, a runny nose, a sore throat, diarrhea, or vomiting, stop handling and working with food immediately. This means you cannot prepare any food, serve any food, remain in the food preparation area, even performing tasks such as washing up, or touch any surfaces where food will be placed, for example, tables. Personal health issues may include vomiting, diarrhea, cold symptoms including coughing, sneezing and blowing your nose, cuts and infected skin, and E. coli. Vomiting and diarrhea are symptoms of gastrointestinal illnesses that can easily be passed on to food. Employees with these symptoms must immediately leave the workplace. If you have these symptoms, report it to your supervisor, who will almost certainly tell you to go home. You will need to be free of the symptoms before you return. This often takes around 48 hours. It is important to maintain hygiene as much as possible during this time, so you will not carry traces of infection when you go back. Other symptoms of gastrointestinal problems that you must report include stomach cramps or pain, nausea, fever. Vomiting and diarrhea may also be symptoms of other non-infectious illnesses. If there is a good reason to believe it is due to this, the person may be able to stay as long as they follow good hygiene standards. If the cause of the symptoms is at all uncertain, it is safer to exclude the person from the food preparation area. Exceptions may be pregnancy and morning sickness, inflammation of the bowel, irritable bowel syndrome, or poor dietary choices, such as excessive alcohol. Food handlers with people in their house who have gastrointestinal symptoms should also be cautious and take extra hygiene measures. They should inform their manager immediately if they feel unwell. Cold symptoms, such as coughing and sneezing, are often acceptable as long as you take proper hygiene precautions. Ensure you cover your mouth and nose when you sneeze. If you do so, do it into your hands, your gloves, and then wash and change immediately. If you cough into a tissue, dispose of it immediately. PPE can be used to prevent the spray of droplets. Try to keep your distance from other employees so you don't infect them. E. coli can be fatal and is easily passed on to food. Therefore, anyone with this infection should be immediately excluded from food preparation area. This includes employees with someone in the house who has E. coli. They shouldn't return until they have a medical clearance. Any cuts, burns, boils, sores, skin infections, or infected wounds should be covered with a bandage when you are working in or around food or food contact surfaces. For minor cuts and scratches, a blue bandage should be worn and covered with a glove. Bandages should be clean, dry, and must prevent leakage from the wound. As previously mentioned, waterproof Disposable gloves or finger cots should be worn over bandages on hands.